how to build these healthy habits. So let me go back to Dr. Sirish, and once again, shifting these gears from looking at numbers, looking at these thoughts that we have learned so far about getting older, how it impacts your health, your overall happiness, your overall well-being. And so how does the patient behaviors, how to form these healthy habits? Do you have any experience? What does it suggest? How can we do these things?
Yeah. What I would like to show is actually a graph here. That will give us an idea. So there is, under the graph is written a term called sarcopenia, which is actually the age-related muscle loss. Um, I'm starting with this one because once you have entered into 30 plus, you will start losing your muscle mass, as it is written there, like about 3 to 5% per decade. Um, so um, so the clock is ticking. Once you are 30 plus. So whether it is actually muscle or bone or brain cells. So you have to act from there on. So if you think in a way like you have come to this world packed with a certain density of muscle, bone and brain cells. So from 30 plus onwards, you will start losing those. So these are the things that there are things you can do to actually change the curve, like either upwards or downwards. So when you change it upwards, it means like you are delaying that degeneration process. By like smoking alcohol and things like that, you are actually accelerating that loss of cells. By those kind of lifestyles. So obviously means it's like an interaction between your genetic makeup, with what quality of the muscle bone and the brain cells that you came with, that you can't change, obviously. And there are environmental factors that will also have an impact on longevity. So for example, the air that you breathe, and the quality of water, and the healthcare facilities in your area. So all these will have an impact on your longevity. But on top of that, the main thing that is in your hands is lifestyle. When I mean by lifestyle, importantly, I'd say three things are the most important. So it's a balanced diet, where you need to eat depending on your level of activity. So if you eat excessively to and you're not that active, then obviously all that extra calories that you're eating will be converted to fat and deposited in the body. In addition to that, obviously there are so many other how you balance your diet with enough carbohydrates, and the fat and things will be available for you, I'm sure, like in many websites. Yeah. So maintaining that good diet, and then half an hour of exercise every day is advisable. So if you actually do maintain good diet and have a good exercise, and maintain your body weight, an ideal body weight with a BMI between 19 and 25 when you reach 50, then you already have added or like you already have added like 7 years to your life. So that's a good thing. Yeah. So fit at 50 is very important. So that should be your goal one, by maintaining good diet and exercise. And also what in a Harvard study which showed like on top of it, on top of your body weight, if you maintain this diet, exercise, and also moderate alcohol intake and no smoking, you can add 14 years for women and 12 years for men for their longevity. I think what I probably would add on top of, I just mainly mentioned about the, weight and physical fitness. Obviously, mental fitness is becoming increasingly important in the current world with so much stress. So I think it's you need to again, think through how you can reduce stress in your life. And also, give body a good rest. So good sleep is also extremely important. So if you maintain that ideal body weight and your mental well-being, and attend the annual health checkups and screening programs, like there are sometimes in Western world there are like 5 yearly colonoscopies to look at pick colon cancer earlier. And there are other, for example, prostate checks and things like that. So all those screening programs to pick cancers earlier. Then with your physical fitness, mental well-being, and the health checks, you could actually healthy manner, so that as we saw in the previous graphs, you can have a happy life later. What this graph almost every day actually on the ward, because quite a few patients come with falls and head injury, needing brain scans. So what it's showing is actually the normal brain, you can see, is quite dense. And the other, what is like labeled as atrophy. Atrophy means shrinkage. So once the brain has shrunk, it leaves that islands of dark fluid. So those are called ventricles. So you can see how the brain volume has shrunk, leaving more of the fluid in the brain rather than actual cells. So this is, I must say, one of the better scans that I found on the Google. In practice, I see it in a much worse state. So it's same, here in the graphic form, where the total brain volume will be reducing. If you see, that starts the countdown at age 30. So you start losing those neurons, and then the ventricle size is increasing. So that's the spaces in the brain. So all these, as I said, can be, that rate of that degeneration is in your hands. So if you actually follow that healthy lifestyle, you can actually, reduce that rate of degeneration. So if you actually, maintain your healthy lifestyle, the lady on the right side, who is an athlete at 90, so you can be very fit. I mean, I again come across, in clinics, quite a fit 90-year-olds, who do the cycling and things like that. And at the same time, I come across 70-year-olds who are very frail. So frailty is a recent concept in geriatrics. So where they have lost their muscle mass and bone, and also the brain cells, like we said. And if you pick up a disease, then their physiological reserve is so poor that they succumb to those infections quite easily. So similarly, in practice, for example, if like a healthy athlete, if she comes with a pneumonia, and a frail lady who comes with pneumonia, I know what's going to happen. The frail ladies will unfortunately not make it if it is actually a good going pneumonia. So it is the reserves in your body that will give you that ability to fight these external factors and diseases. Means we have seen that in COVID times as well. Patients with who are obese and diabetes and all these, they are the ones who unfortunately had complications. So that's how important it is, to preserve that health.
I love the language that you used after scaring us is about this, kind of building this reserve, getting ready for it, and how some of these things can actually have an impact not only on some of these ill understood concepts which are mostly known only by the doctors, but also by a common man. Say for example, preserving your weight, having a healthy habit of eating, how can it change actually the number of healthy years you live in? I think that's a fantastic concept, can be understood by everyone. And that was really, really well explained, Dr. Sirish. Thanks for that.